Okay, Petey, sit right there. You got your shot. Now, did that hurt at all? Now, Petey got their vaccination, so kids out there, make sure you get yours. And speaking of vaccinations, we're back on an important insight on the measles outbreak and childhood vaccines. Joining me now is Baptist Medical Group physician Dr. Janet Geiger with River City Pediatrics. Dr. Geiger, meet Petey.
Nice to meet you.
All right, we heard about this recent measles outbreaks and some of the issues along with that. So tell us about what happened.
Well, you know, it wasn't that long ago, in the year 2000, 15 years ago, that we got pretty comfortable. Measles was essentially eliminated in the United States. And think about that, that's a big deal. That was due to very successful and effective vaccination. And then here we are. We're all very well aware of the recent outbreak starting in California, and that has spread to a few of the adjacent states. There are now reported cases in Illinois. That's close to home. Mm-hmm. So we can't get comfortable anymore. Measles is a very highly contagious disease. So the threat of it spreading and continue to spread is very real.
Now we think about measles as just being a little rash and fever, but measles is more than that.
Absolutely. Again, we've gotten comfortable because of successful vaccination, and we've forgotten it. It's contagious disease and can be actually deadly in younger children. It can start out with high fever and cold-like symptoms, cough, little runny nose, eye irritation, but it's associated with a lot of common complications such as ear infection, diarrhea that can lead to dehydration, and pneumonia. And that often will put a child in the hospital.
Now, a vaccine would prevent this.
Absolutely.
Now, doctor, tell us about all of this controversy that we've heard over the last several years about vaccines, association with autism, the risk of vaccines, contaminated vaccines. Tell us about that.
Well, sadly, there are, I think, misinformation out there in terms of the link between vaccines and autism, because there have been repeated very good scientific studies, and none has shown any link between vaccination and autism. And vaccines are very safe, they're well tested. There are standard recommendation for vaccines when they should be given. Unfortunately, there are families that opt to not just refuse vaccine, but delay vaccines. So they elect to follow a non-standard vaccination schedule that spread out the injections over a longer period of time, and that puts children at risk for contracting the disease because they're not well protected.
Now, why do people do that? What's the thought behind that? There
are just information that circulate that scare parents, and it's hard to sort out what to believe when you are bombarded with information from different family members, friends, websites. But experience show us, again, going back to just 15 years ago, we were very close to eliminating measles in this country. And yet here we are facing an outbreak. And when you look at the reason for the outbreak, the cases are occurring in people, and mostly children, who have not been vaccinated, either because they're too young to receive the vaccine, or more commonly because the parents have chosen to withhold the vaccination.
So not only by withholding the vaccination, you're putting your child at risk, but you're also putting other people at risk as well.
Absolutely, especially the younger children. The measles vaccine is recommended to be given, the first dose to be given between 12 and 15 months of age. So obviously, newborns, infants, who have not received the vaccine would be at risk if exposed to someone with the measles. And therefore, if an older child who had not received vaccination contract the disease, again, like you said, it's putting younger children at risk.
What are some of the other common vaccinations that children should get?
There are hosts of vaccinations, immunizations. It sounds scary when we start to name them, but in the first year of life, we protect children against whooping cough, and that's part of the vaccine that's called Dtap, that also protects against tetanus and diphtheria. There's TD, which protects against meningitis, and it can also cause other respiratory problems, pneumonia, polio, and also rotavirus, which can cause severe diarrhea. Those are just a few that we focus on children in the first year of life. And then there's measles, which is a part of, the vaccine is given as a part of measles, mumps, and rubella, and sometimes combined with chickenpox as well. And as you move to the older population, there's hepatitis A, and I'm sorry, I didn't mention hepatitis B, which is also given. And again, it sounds overwhelming when we start naming all these vaccines, but they're very safe.
But they're very safe. The literature is quite clear that they are very safe, very effective, and as we can see, it saves lives.
Absolutely. And we can also see that delaying or choosing not to vaccinate causes the complications that we're now facing.
Well, thank you so much for being here today. That's excellent advice.
Thank you.
Now, coming up on Health Matters, the administrator of the newly opened Spence and Becky Wilson Baptist Children's Hospital will let us know what the hospital has to offer, as well as what's on the horizon. You don't want to miss this.